In the same review, it's also possible to come to the conclusion for what is exposed that Down syndrome is a neurodegenerative syndrome. That is, that degeneration is an universal characteristic of Down syndrome, as hypotony, intellectual disability, for example. But there are already some ways to combat excessive oxidation with the use of supplements you note in the review. You talked already about ECGC, but that has also probably can have other benefits. In terms of efficacy and safety, which supplements do you think are today that can be considered beneficial, or if there are any?
Yes. So, I wish we know what is the main mechanistic biological problem in Downs. You said neurodegeneration. I would say it's neurodevelopment. It's the development of the nervous system that is probably not correct. It is the energy metabolism in each cell that is probably not absolutely normal. It is the signaling of the different events in the cell that are probably abnormal. And then later on in life, there is accelerated aging and degeneration. So it's not just degeneration only, it's the development also that is problematic. So because chromosome 21 has many genes, 250 or a bit more, it is not a simple disorder. It's not a disorder that there's one gene that causes an abnormality. It is many genes on chromosome 21 that cause the problem. So Down syndrome, myself, I see it as a difficult and complex disease or condition due to many mechanisms. Each gene contributes to the mechanism, so it's not just one thing. Mm-hmm. It is many. And each one of them, for each one of them we need to understand. Of course, the most important one is the intellectual disability. So we need to find out the intellectual disability problem, and all the other ones, they're secondary. We can live with them. We can live with them not as priority. I mean. Mm-hmm. So the neural development is problematic, and you can see this very easily. Everybody can see this very easy, because when a Down syndrome child is born, is not that much behind a so-called normal child. The problem we see like at the end of the first year, 1.5 years, 2 years, because our brains continue to develop in the first 2 years. We are born with unformed brains yet. So the brain continues to develop, and as it continues to develop, it develops in normal individuals and not well in the Down syndrome individuals. And that's why we see the problem as the child gets a bit older. So it's a problem of development. Mm-hmm.